Oh, I'm not feeling well. I need to see a doctor. I have muscle pain. My neck, my back, my arms, my legs. They all hurt. A never-ending flu. A sore throat. And my knee. It is horrible. I am lost in my own neighborhood area. No memory. I have constant anxiety and panic attacks and nightmares and hallucinations. I have night sweats. And tremors. And twitching. And a tingling sensation. And I am always tired. I can hardly exist. What is wrong with me, doctor?
I am afraid your case is too complex. You need to see a specialist. I know a good hospital with excellent doctors.
Good news, nothing wrong with you. Everything came back negative.
I am a psychotherapist. Let's try Xanax first.
And I am a Lyme activist. I came to save you.
Bullshit. There is no such thing. Your Lyme test also negative.
Did you ever have a tick bite? Or a red rash?
I don't remember.
I am sure he has chronic fatigue syndrome. Or fibromyalgia. Or depression. Or multiple sclerosis. Or Parkinson's. Or sleeping disorders. Or Alzheimer's. It is 100%.
Or chronic Lyme disease? Or Bartonella? Or mycoplasma? You know Lyme tests are unreliable and flawed. Only 20% see a red rash. Some of the ticks are so small like a dot. Now, can you find the red dot on the board? Can you find a tick that size? Whenever you are a patient or a doctor, you can find more information at www.elides.org. And don't forget to watch the movie Under Our Skin. Goodbye.
Good evening. Welcome to the program. Can you guess what is common in former President George W. Bush, Michael J. Fox, Richard Gere, Daryl Hall and Yolanda Foster? Did you guess it right? Yes, it is Lyme disease.
What?
Good evening from the studio and welcome to our live audience. Today we are here to discuss chronic Lyme disease. Does it exist at all? Doctor thinks it does not. Lyme activist tells us it is real. George W. Bush is one of the most famous example. However, doctors kept his Lyme disease secret for a year. Actor Richard Gere feared he would die after contracting this potentially fatal disease that confined him to bed. He told friends, "Just turning my head to see the time on the clock was a major operation. I felt as if my life was going in slow motion." Real housewife Yolanda Foster had chronic neurological Lyme for 2 years. She said, "It's essential that a reliable diagnostic test for Lyme be developed and the research efforts be supported to find a cure for this silent killer." Doctor, what do you think?
I think people like to be scared. Take Lyme disease. This is a very hard to get and very easy to cure disease, yet no end to the fear people express.
False. The fact is Lyme is a complex disease that can be highly difficult to diagnose. Reliable diagnostic tests are not yet available. Lyme disease is often referred to as the great imitator because it mimics other conditions like chronic fatigue, multiple sclerosis, Parkinson's, Alzheimer's, and many others.
You don't seem to agree, Doctor.
Test Elisa has 50% sensitivity. I don't understand why it is not enough for the patients. They always complain. Long-term antibiotics are dangerous. Still they want antibiotics instead of the blue pill, the white pill, the orange pill or steroids which they have to take lifelong.
We say goodbye to our viewers now, but before that, Lyme activist, what is your last word? A final advice?
If you had a tick bite and you are not feeling well since, or if you saw several doctors but no one could help, always ask for a second opinion, preferable from a Lyme-literate medical doctor called LLMD. The International Lyme and Associated Diseases Society can provide you with more information.
Thank you for your attention. Good night and goodbye.
I simply love hiking and listen to the birds.
I totally agree.
Are you awake, honey?
What? You talking to me?
Are you awake?
I think so.
Did you have another nightmare with the ninja?
Not this time. He is right behind you. But don't worry. Supergirl will take him down.
I think you are hallucinating again. I cannot see it. But it's time for you to see a doctor, don't you think?
I already did remember. The endocrinologist said it is a thyroid problem. Neurology assured me I have multiple sclerosis or Alzheimer or Parkinson's. The psychotherapist asked me why do I want to spend my life in bed and prescribed Xanax. What else can I do?
I know. We have a visitor who might be able to help you.
Is that a ninja? I'm just kidding. Kate told me about your hallucinations. Don't worry, it is quite common with neurological Lyme. You are not crazy. I am a Lyme activist and came to help you find a good Lyme doctor. I know it is hard to believe after all you experienced, but trust me, they do exist. The International Lyme and Associated Diseases Society is a great way to get a Lyme-literate doctor referral, and is probably the best place to start.
What is the matter, honey? Is it the ninja?
Not anymore.
Ask your doctor about Lyme. If he or she says 20 days antibiotics is enough and tests are reliable, seek another one. Remember, chronic Lyme test negative most of the time. Diagnosis should be clinical and based on your symptoms. Look for a patient support group. There are several on the internet. You are not alone.
What is wrong with your eyes?
Nothing. Just wanted to cheer you up. Today is the big day.
You told me before. Each time we went to see a new doctor, it never worked out. Why would this time be different? Okay, you're right. This time will be different.
Hello. Do you have an appointment?
It is possible. I hope. I don't remember.
No worries. Lyme disease likes to play this game. You will get over it with treatment. Please sit in the waiting room.
Hello.
Hi.
My name's Alan. I'm from Australia. What are your infections?
Mine what?
A new guy.
Tell me, what are you doing so far from your home? Isn't there a good Lyme doctor in Australia? Excuse me, but what is so funny?
There is no Lyme doctor in Australia because we have no Lyme in Australia.
Oh, that's nice. I love your country. So what is a co-infection?
Lyme is frequently associated with so-called co-infections. Other microorganisms can infect the patient at the same time with a tick bite.
How do you know you have them?
It should be a clinical diagnosis. In some cases the symptoms are typical. But sometimes it is tricky to figure them out.
Hello, Brian. I am Dr. Lyme. You're next. Hello again. I'm glad your wife could make it. Family support is very important.
Thank you, Dr. Lyme.
Are you familiar with the Lyme checklist?
Not really.
No worries. I will ask a few questions. A symptom list. Just nod if you have them. Persistent swollen glands, sore throat, fevers, sore soles, joint pain, joint swelling, unexplained back pain, stiffness of the joint or back, muscle pain or cramps, obvious muscle weakness, twitching of the face or other muscle, confusion, difficulty with concentration or thinking, word search, name block, poor short-term memory, disorientation, getting lost, depression, panic attack, anxiety, hallucinations, paranoia, bipolar, tremor, seizures, headache, light sensitivity, sound sensitivity, ear pain, double or blurry vision, floaters, facial paralysis, vertigo, fatigue, trouble with sleeping, hair loss, bladder problem, low abdominal pain, chest pain, palpitations, breathlessness, night sweats. Now let's see the result. I can already see you scored very high. A chance for you to have Lyme disease definitely there. Now I know which blood test to order and hopefully we'll be able to tell you the diagnosis next week.
Good evening, ladies and gentlemen. Welcome back to the program. Today's guest is Doctor and Lyme activist. We are going to talk about the worldwide Lyme protest. Lyme activist brought a few poster. Let's see.
If your doctor is relying on this test to determine whenever you have Lyme disease, run. There are several others available. This picture speaks for itself. If Lyme is only in our head, how come we cannot walk or stand unaided? A male tick does not feed as long as the female. You may lose it within a few minutes and never realize you were bitten.
So tell me, what do you hope to achieve?
Recognition that Lyme disease and other tick-borne infections are serious and sometimes fatal illnesses. Education of the healthcare sector regarding the accurate diagnosis of Lyme, which in some cases may be limited to clinical presentation due to limitations of serological testing. Education of the healthcare sector. This includes the need to update the outdated treatment guidelines of the Infectious Diseases Society of America.
Brian, are you with us? How's life?
Hi, good evening. Today it is okay.
When you say today, what do you mean by that?
Every day is different. I never know whenever it is going to be a good day or a bad day. Symptoms come and go even within a few hours.
It only shows that we're dealing with an attention seeker. Serious patients are sick all day long.
Wrong. Symptoms may come and go, sometimes within hours. It is typical and should be a warning sign for Lyme.
Brian, do you receive any treatment?
Yes, I do. Antibiotics. At first it was very difficult to take them because I felt I got worst. It was very scary.
You got worse because you had an allergic reaction. You should have never taken antibiotics instead of the blue pill, the red pill, the orange pill or steroids.
Wrong again. Brian had a Herxheimer reaction, a massive die-off of bacteria. Your body is suddenly overrun by toxins. It is a common reaction with Lyme. Ask your doctor.
We are saying goodbye, but don't forget. Lyme is there. And it ticks. Ticks. Tick.